just as a reminder. All right. So, stress and burnout, or compassion fatigue, as they call it oftentimes now, really can include feelings of being emotionally exhausted, decreased feelings of personal accomplishment or evaluating ourselves in a negative way, and depersonalization, having these negative, cynical attitudes that can so often crop up when we're starting to really feel burned out. COVID, would come as no surprise to anybody, did lead to increased feelings of stress and burnout. And stress, burnout, compassion fatigue, all of this affects about 20 to 40% of us, and about 21 to 67% report experiencing severe symptoms at some point during our careers. So that's a big group of us. Difficulty with productivity demands, life demands, it can make us feel selfish for incorporating time for ourselves and self-care into our routine, because we're responsible for not just people at home, but people in our work life. So our jobs are very different than I think the average, and our brains don't stop at 5 o'clock and the work doesn't stop at 5 o'clock. And it's hard to find that balance, but you all already know all of that and feel all of that. It can impact us both physically and our mental health, can lead to job dissatisfaction. And I think we've all experienced the high degree of turnover. COVID wasn't a help to that. And it can make us feel, less effective in our work. We have difficulty building that therapeutic alliance with the individuals with whom we work. We may make mistakes more often. Our communication skills may not be up to par or up to our best. Sometimes paying attention can be difficult, or staying focused in sessions. And just feeling this sort of overarching disconnect from others, where we might seem less attuned or sensitive or empathic, which, is the furthest thing from what we would ever intend to do. But sometimes, those things are difficult to kind of squash or hide a bit when we're really sort of at our limits. But it's part of our profession, and it really is a part of our craft, this self-care idea. And so how do we reframe our thoughts about it, that it's this professional imperative? It's not a luxury. It's not selfish, because without it, it's really difficult for us to provide good patient care. And when we're not making self-care a priority, we may be have poor modeling of healthy emotions or coping skills. We're recommending good self-care to the individuals with whom we work, and they, look at us and we're looking tired and burnt out and having difficulty staying on task. And it's also harder for us to have flexible and creative thinking when we're under stress. And that's something that's so critical to our profession, is to really be able to kind of be on and in our work, and really have those moments with individuals where, they're talking about what's going on in their lives, and be able to reflect back to them something that's kind of creative, or a different way to consider how they're thinking about their own lives. And that can be difficult when our brains are elsewhere. So some practical strategies: getting back to basics, remaining self-aware and listening to our bodies, thinking about how we define self-care, with this idea of flourishing versus are we just surviving and are maybe we just making it day to day. I think, for me, self-care is another item on the to-do list sometimes. And that can be a dangerous thing, because then it feels like one more thing I have to do and I failed to do it, or I didn't do it well, or I didn't fully commit to it. And so how do we think about self-care as not an item on the to-do list? Celebrating progress and success. I don't think that we consider that often enough individually, but, also with the team, with these kinds of communities. I think that that's something important that we need to do more of, or would be helpful for us to do more of. Especially in our world with these echoes and things like that, we talk about really complex, difficult cases that are draining, or frustrating, or we're feeling at a loss, or we're feeling like we're being ineffective. And, we don't always reflect on the wins that we get. And so, incorporating that more into these echoes as well could be helpful. Taking a proactive approach. So how we engage with people that bring us joy, things that help us relax. Seeking out support, not just from friends and families, but also the people with whom we work in our communities. Establishing work boundaries, especially when we're working from home, it's very easy to just wander into the office and work an hour or two in the evening. I know I don't have good work boundaries. I don't know about anybody else when the office is just so close and you just have to send that one email and then you look up and it's been 2 hours. And so, establishing those work boundaries and really trying to stick to them, embracing flexibility, scheduling activities that we can look forward to, but also that give us a sense of mastery. And I think that's something that sometimes we lack. So it's great to schedule, something that we enjoy, that's wonderful, but also something that we want to learn and something that we haven't tried before, or something that gives us this sense of skill or the sense of mastery or the sense of growth for ourselves. Practicing self-compassion, recognizing our limits, giving us some grace, letting us off the hook a bit, and finding empathy for ourselves, which we are really good at doing with the individuals with whom we work and our colleagues, but do we do the same for ourselves? So resiliency, thinking about provider level, individual level resiliency, there are a lot of challenges with our work, especially when working with individuals with psychosis, but not limited to that because you all carry caseloads outside of that. But there are also a lot of benefits. And so reflecting on what some of those benefits may be, and we can talk about that, or you can share some of the benefits in the chat. That would be wonderful. Prioritizing ourselves and thinking about sort of this holistic picture of mind, body, spirit, emotions, work, relationships, modifying the thoughts that really hurt us. So wishful thinking is the risk to that is we become passive and avoidant. So how do we remain active in our lives, not just our work lives? Self-blame, this uses valuable energy. But if we know our limits, we're gentle with ourselves and we recognize what's outside of our control versus what's inside of our control, that can be helpful with decreasing that self-blame. Key components for resiliency: realistic optimism, social support, having meaning and purpose, which we talk endlessly about how important that is for the individuals that we work with. Facing our fears and active coping. This group, obviously we can thank CBT. And building stress awareness and how do we match our levels of stress with our response? Because, as we all know, when our levels of stress are higher and we're running on that high gear, smaller things can lead to bigger responses and reactivity with stress. And so just being mindful about, is this something that deserves this level of response? Would this be my response in a different situation or circumstance when my stress level is lower? And just kind of being self-reflective on that. Savoring our successes, both big and small, and sharing those with our team. As we said, we don't talk about that often enough. How to find ways to maintain a calm and supportive environment. And if you're working from home, that's not always the easiest thing to do, especially at home if you've got a lot of people in the house, but hopefully we're coming through the backside of that with COVID. Growing through your experiences and sharing those experiences to help others learn. And having gratitude for our wins, or the ones that maybe they weren't wins, but we can consider them lessons learned and how they've helped us grow. There are a couple great links that, I just wanted to highlight. So there's sort of the starter kit for self-care that you can check out. There's also a really nice wellness webinar series, if you want to spend some time really reflecting and taking that space. Here are some places that you could start. And there's also the self-care thought records. So we're all super familiar with thought records. And so thinking about stresses at work, is our stress level, are we starting to notice stress? Are we starting to have symptoms of stress? Is our stress bucket starting to overflow? Just keeping that self-monitoring in place. Thoughts, emotions, behaviors that can move us forward, behaviors that seem to be keeping us stuck. Catch it, check it, change it, obviously, and then really thinking through our action plan and our outcome, things that we can do to keep moving us forward. So just a little bit of self-reflection, how successful do you feel like you've been lately with self-care, and what can you do more or less of to promote that self-care and to help build resilience? If anybody wants to share, you're welcome to. I think for myself, there is room to do more or to do better. So I was really appreciative of this topic and of the timing of the challenge, because I think it just made me a little bit more mindful of where I might be at. So, just thinking, how successful we've been lately and what we may be able to do more or less of. And then there is a self-care checklist as well that you can visit. And so, it offers all different kinds of tips. And I just listed the categories here. Some of them are CBT, restructuring our cognitions, refocusing our rewards, cultivating spirituality or a mission, fostering creativity and growth, all different kinds of things. But it really does a nice job of giving examples or describing or helping prompt us to think through what some of these may actually look like for us. So if you want to visit that website, and they're also all included in the references.